help asking you a few questions about some other,
Sure.
certainly infectious illnesses and issues. Flu season is coming up. Can you talk about that, Doc? And what are you seeing for this coming year?
Absolutely, absolutely. So yes, like you said, the flu season is coming up. Typically seen between October and May. The bulk of cases occur between January and February. And I did talk to Suffolk County a couple of days ago. For the week ending October 8th, the 40th week of this year, we still haven't seen any respiratory virus that's really
flu-like
come through so far. But there have been some cases in Arizona and Pennsylvania for pediatric cases, but we still haven't seen any in our community as of now. One thing which I will like to point out, I get this question very commonly when I try to talk to patients, particularly over 65, when I talk to them about the really best way to avoid getting the flu is to get the flu vaccine. It's really been recommended since the 1960s by this committee called the ACIP, which is the Advisory Committee for Immunization Program. It's really been advised since the 1960s. And the recommendation, who gets it? Everyone. Everyone over the age of 6 months and above should get the influenza vaccine.
There's a tremendous amount of, again, I would say, ignorance around the around vaccination.
Absolutely.
And I've heard people say, I don't want to get the vaccine because I'm going to, it'll give me the flu. And can you comment on that?
Absolutely. It was, the concept with getting the flu vaccine really is every year researchers work very hard to predict which 3 strains that they think will likely be the culprit of illness in the 2011 to 2012 season. So this year they have predicted that a couple of viruses, one would be the H1N1, which we had 2 years ago, another virus called the H3N2, and the other one being the influenza B virus. So they have predicted that these will be the dominant strains that will be circulating in our environment, and that's what they've selected to give in this year's vaccine. The issue really being, questions people ask is, well, I've had the vaccine and I get the flu. Well, the issue with that is basically the efficacy of this vaccine, to be very honest with you, is anywhere between 50 to 60%. It's pretty lousy, to be honest with you, 50 to 60%. And to extrapolate one more step, it works even less in the elderly. So that's it's a reasonable thought process when an elderly gentleman or a young lady over 65 says, well, I don't think it's going to work. And the answer to that really is the burden of illness. So 90% of influenza-related mortality occurs in patients over 70. So really, getting the vaccine, sure, it's a pretty lousy efficacy rate. It ranges anywhere between 50 to 60% in the population over 65. But one thing to keep in mind is you may get a flu-like syndrome, and there are hundreds of respiratory viruses that are circulating. So you may get another respiratory virus. But the important thing to remember is the risk of you getting the complications, which is a bloodstream infection or getting a severe pneumonia or other life-threatening conditions, are all avoided when you get the vaccine.
And bear in mind that flu kills.
Absolutely.
And every year a large number of people die. And
Absolutely.
certainly you're at least cutting your chances in half by getting the vaccine. So.
The burden of illness really comes down, and if we really talk about the millions of people across the country who get the flu, 60% efficacy is pretty good, actually. I mean, if we're cutting down 60% of the illness out of millions of people, that really does wonders for the healthcare system. It reduces the number of people getting sick, reduces the number of days lost at the office. It really does a great job. So I definitely advocate for the flu vaccine. There was, in 1976, the flu vaccine, when administered, caused some neurological side effects, but we really haven't had any repeat incidences of that. So it's very safe, it's been tested. I strongly advocate for it. I do know we have a program coming up sometime, Bob.
We do, and I know we'll be showing the information for our free flu shot day as well, and we'll encourage everybody in the community to do that. Great. I'd like to thank both of you. You're both great resources for the community, and the hospital I know relies on both of you. I'd like to welcome you and thank you for joining us out here.
It's my pleasure to be here.
Dr. Fernando, and we hope you'll have a very, very long career out here with us. We certainly need you.
Happy to be here.
And I'd like to thank everyone for joining with us today, and please heed the message of both Michael Collins and Dr. Fernando. Get tested if you have any concerns, and also get your flu shots. Prevention and education are both the most effective ways to battle disease. I'd like to thank you for listening or watching us today. I'd like to thank CTV for producing and airing our show in Southampton, and LTV for airing us in East Hampton. And if you have any questions or concerns or would like help navigating the healthcare system on the East End, please feel free to call my office at 631-726-8555. Thank you.